Hello and welcome to YHTV's Magical Medical Tour. Thank you for joining us today. I'm Christina Souza-Ma, and with me is our wonderful medical guide, Dr. Glenn Woolman. What's up, Doc?
Hello, Christina.
Hello, Dr. Woolman.
How are you?
Fantastic. I'm bouncing.
I know, I see that, and I hope you're going to be bouncing more. This is going to be a very special show today.
Very special. Very special.
Greetings, everyone. Welcome to Magical Medical Tour. I'm Dr. Glenn Woolman, and I will be your medical guide, along with Christina, as we travel through another quadrant of the healthcare galaxy in search of optimal health. And today, we're going actually into uncharted territories for us. We're going to be interviewing Scott Spaulding, and to be very clear and open and transparent, he is a client of mine, and he is willing to come on and talk about his life right now, and that's what our interview is going to be about today. So, Christina, as we move forward, I know there will be people that might want to comment on this or talk with Scott at some point. How do they get in touch with us?
Thank you, Glenn. At any time during this show, you can feel free to ask a question or make a comment simply by scrolling down on your screen and typing it into the comment box. And no matter when you see this show, could be a year from now, 6 months from now, you can still do so. And we will make sure that your comment or question reaches the individual, whether it be our guest or Dr. Woolman or us here at Yoga Hub. We will respond to it. And if you are listening to this through a podcast, iTunes, give us a call. 818-LETS-TALK. 818-LETS-TALK. Be sure to leave your contact information so that we can get the answers right back to you. Thank you so much, Dr. Woolman.
So Scott Spaulding, we are going to talk with him, and we're going to go on a journey with him. He's a 49-year-old male living in Santa Barbara, and he works for the government, the regional government in Santa Barbara, and he was living what he considered a normal life with his wife. In fact, they were planning a trip to Africa when that journey changed for a new journey. And today we're going to find out about that journey. And in order to do so, I want to introduce Mr. Scott Spaulding. Greetings, Scott.
Hi. Thanks for having me.
Hello, Scott. Pleasure to have you here on our show. Thank you so much.
Sure thing.
Scott, usually as the medical guide, I try to tell our viewing audience and listening audience where we're going to go. But this is a journey that we're not sure where we're going, actually, because you have volunteered to talk with us over multiple shows and follow us as you journey through a diagnosis of cancer and all of the treatments and the potential healing. We don't know how this is going to end, is what I'm saying here. So this is going to be very interesting for us. You okay with that?
Absolutely, yeah. I think it adds an element of drama.
It definitely adds an element, and that's how much drama it adds to it. I can't even speak anymore. So that was the original part, Scott. You were just living a normal life. We're going to talk about a little bit of your past history, present history, and future history. But you were living a normal life, and you had plans to go to Africa, right?
That's right. Yeah, my wife and I, for several years, have been planning a trip to Africa. We haven't been. We had put that off for several years due to a variety of reasons. And we had finally had everything settled, actually paid for the trip. We're going to go in the last 2 weeks in May and June, and about 3 weeks before we were supposed to fly out is when I got the diagnosis.
Okay, and let's go before the diagnosis. You have a family history. You have a maternal grandfather who had colon cancer.
We think so. Yeah, this happened in the 1930s. And so, not really good medical records back then. And so the suspicion is that he had some sort of colon cancer. He had an operation to try to treat it that went very wrong, and that led to some very serious complications that stayed with him for the rest of his life. But the conventional wisdom in the family is that he had some sort of colon cancer to start with.
And then you had another grandparent who had stomach cancer.
That's correct. And again, this was back in the 30s. So this was my paternal grandmother, and she died at age 50 when my dad and his brother were teenagers. And the story that the family knows is that it was stomach cancer. Of course, that was kind of a catch-all phrase back then. Mm-hmm. No one really knows what it could have been or what it was, and we don't really have any. I don't have any information about the kind of conditions or the symptoms that she had, or the conditions that she was living in before she died.
Right. Your father had prostate cancer.
Correct.
And was that the reason he passed away?
He had advanced prostate cancer. He also had a bad heart valve, and so I think between those two, it was about 2 years that he was sick at the end of his life. And what ultimately was the cause, we're not sure, but it was probably complications from or a result of the prostate cancer. And
your mother had a benign polyp surgery, and she's still doing really well at age?
She turns 91 next month, or in September, I should say. And she's going very strong. She has very much a spirit. She has some medical complications, arthritis, but she has quite a bit of life in her right now at age 91. So she's very much going strong.
And you have a number of siblings that are older than you and in relatively good health?
Yes, I have 2 older brothers and an older sister, anywhere from 7 to 12 years older, and they're all in, very, very pretty good health. Very good. No complications or anything.
Knowing this right now, without anything else, did you take that into consideration in any lifestyle or any processes of getting regular medical checkups with a history of cancer in your family? Was that something that you focused on?
No, I certainly didn't. Well, until my dad was diagnosed with prostate cancer, I wasn't thinking about preventative cancer lifestyle. Mm-hmm. I was in part relying on the fact that I was the youngest of 4 kids, and odds are one of my older brothers or older sister would have some sort of issue before I would. That turned out to be wrong. So
they let you down.
There was no filter there. So that and when my dad was diagnosed with prostate cancer, that's something that typically affects older men, and so and very frequently, the older you get, I'm not sure what the percentage is, but it's very high. If you live long enough, you're very likely going to get it. So, but I wasn't thinking about cancer at all at age 49.
Clearly, and you're making plans to go on a wonderful trip. And this is part of the reason we're doing this today. There are many people out there that are making plans to go on a wonderful trip. Would you have a message for them about the genetic part of this process? As we go through, we'll talk about other things that we can learn from this. But in retrospect now, would you have changed anything?
Well, changed anything how?
In terms of maybe getting more checkups or looking at healthier lifestyles, anything like that?
Well, hindsight's 20/20. So,
yeah, and that's what we're looking for right now. Some hindsight for other people that are moving forward.
The one thing that I would say for sure, with my particular case, which was colorectal cancer, colonoscopy is the first step of trying to find out if there is anything to be known. And that usually starts at 50, unless it's some sort of symptom-based procedure. So one recommendation I would have to anyone that's listening or watching is if you have any symptoms whatsoever that could be associated with any kind of issue at all, and it's not just colorectal, it's anything, get it checked out. And when it comes to, say, colon cancer or colon issues, if you have symptoms, get a colonoscopy. Don't listen to your doctor if they try to put you off. Just get it done. And that's even though most of my friends are turning 50 right now, which is when you start doing it, routinely or as a screening. Most of my friends have a a little bit of extra incentive to be doing it, and they're all doing it right now, which is good.
Great.
And in fact, one of my friends, the colonoscopy found 2 benign polyps, so it's a good thing he did it.
Very good. You're an advocate now. So now you're getting ready for your trip, and what happened that made things change? What were your symptoms or signs?
I had blood in my stool for the last, probably year or so, infrequently but noticeable. And I went to my primary back in the fall of 2014. She recommended a colonoscopy. It was before I was 50, and for whatever reason, and I don't really know exactly what the reasons were, it simply wasn't scheduled by the medical clinic that I was with then. I didn't follow up myself to make sure that it did happen, and so I think it was originally scheduled to be in November of 2014, and it didn't happen. And I went back to my primary for another checkup in March, and talked about the same symptoms, which were still present. And she recommended it again, and I scheduled it again. And this time the same thing happened, where the medical clinic just didn't follow through. I wasn't contacted to schedule. There had to be an insurance approval process. But this time I followed up myself, and it was actually very difficult to get the colonoscopy scheduled for me. I think it was because I was 49 and not 50, but I'm not sure. And when they finally did agree to schedule, they scheduled it for something like 3 months out. And I said, that's not acceptable. I need to do it sooner. And so my primary actually stepped in and asked them to schedule it sooner. And that was in April. And that's when I had the colonoscopy and they found the tumor.
So let's talk about this for a moment and focus on this. What would you do differently, or what would you advise people that go to their doctor? First of all, I'm assuming that you would now advise people, if you had blood in your stools for a year, you wouldn't wait a full year to do it. You would do something sooner now, and you would recommend that. But let's talk about the other part, where you go to your doctor appropriately, your doctor orders a colonoscopy appropriately, and then nothing happens. So what would you do differently now? How do you see the strategy for someone else who does the same thing and it doesn't get done?
Well, 21st century healthcare in America, the patient has to be responsible for their own healthcare. They have to be their own advocate. And so you have to, as the patient, be aware of certainly what your rights are, whatever your medical coverage is, if you have it, and make sure that you are looking out for yourself. Doctors and medical care often treat the disease or the symptoms rather than the patient. And so you have to think about yourself as your own advocate. And even though you're not a doctor, you need to know as much as you can about any symptoms that you might have, what it could be, what it's not. And then hopefully your doctor is working in concert with you to try to address whatever issue it is if you have an issue. But you have to look out for yourself as you enter this journey.
Excellent advice. Would you have anything to say to the doctor in terms of what other doctors should consider doing when they order a test, a follow-up on their own part to make sure that things are going well?
In an ideal world, doctors are challenged in this country, the way healthcare is delivered. They have all kinds of demands on them. I understand that, and they often don't have the luxury of spending time with the patients as much time as they would like to. So I understand that, but at the same time, there is a certain sort of base responsibility, I would think, on the part of a physician to be able to look out for the interests of all of the customers, I would call them, all of the patients that they have. And so, it would be nice if everyone could find an ally and a really strong advocate as a primary care physician. I know that's not really realistic, but that would be the ideal. And the other thing that I would mention in terms of a patient being an advocate for themselves, again, if they have any symptoms or any issues that are going on, is to know what the symptoms might be. First of all, you have to be aware of symptoms. There's a lot of non-specific symptoms out there for all kinds of stuff. And, it's important to not be alarmed that you have a headache. It doesn't mean you have a brain tumor, that kind of thing. So the internet is really powerful, but also really scary. There's all kinds of misinformation on the internet, but you can actually find out some information, and hopefully it's good information that you can take to your doctor and be able to talk to them in an educated fashion about what may be facing you, what different treatment options are, and things like that.
Well said. I really like that. And just to be clear, you had no other symptoms. You didn't have constipation or abdominal pain or infrequent bowel movements or abnormal bowel movements other than the blood. That was your only symptom and sign.
Yeah, and it wasn't even, that's correct. It was just that one symptom, and the blood itself wasn't obviously self-evident, in the stool. So it was, and it wasn't, every time I went to the bathroom either. So, who knows what it could, it could have been hemorrhoids, it could have been anything. And so it's, with everything, it's certainly something as major as cancer, better safe than sorry. Try to do everything you can to figure out what it is, so that you can treat it.
All right, so now you go and you get your colonoscopy, and of course you and your wife are concerned, and you don't have the answer yet. You finish the colonoscopy. What's going through your mind in terms of any fears or any thoughts before you got the actual diagnosis?
I was awake during the colonoscopy, and so I was watching the video monitor of the camera. Mm-hmm. And so I could see the tumor when he came across it.
Okay.
He didn't identify it, as that. And when he didn't do anything about it, it wasn't a polyp that he could remove or anything like that. That was the first signal that it was a serious situation. In the recovery room, immediately after the colonoscopy, the doctor came in and, and immediately told me that he had referred me to a surgeon, and that's the second signal that it's a very serious situation. If you're talking about surgery, 20 minutes after the colonoscopy. So, but they took a biopsy in the colonoscopy, and I think I had the colonoscopy on a Friday morning, and my clinic has an online medical communication system. And on Monday afternoon or evening, I received via email the results of the biopsy through a posting to my record, and the term it was identified as invasive cancer. So that's how I found out what it was.
I already knew this, and as you were just saying that right now, a chill went through me in reading that. And I was wondering how a person nowadays in technology world, would you rather have gotten that way? Would you rather have gotten it in a doctor's office maybe 2 or 3 or 4 days later? How do you feel about that way of receiving the information? And then what was your immediate reaction?
Well, everyone's different in terms of how they like to consume information or be communicated with. I was okay with that. I had a strong suspicion based on, the previous couple of days that it was not going to be good information. So I wasn't surprised to see that test result. There's for me personally, and again, everyone's different. I think there was some benefit to hearing that news at home rather than in a, foreign doctor's office that's uncomfortable and sterile. Other people certainly would rather have that type of diagnosis communicated personally to them, which I totally understand. But I was actually okay with that. I got the information around, 6 o'clock or something. My wife got home at 6:30, and I told her right away. And, that's when the ball started rolling. The diagnosis is cancer, and then the question is, okay, we knew it might be like this, or we knew it might be cancer. The question is, now what?
Right. Your journey to Africa was changed to a journey to survival.
Right. Well, we didn't know yet. We didn't know what that meant. We were still optimistic because we weren't leaving for several weeks. Maybe it could be taken care of. Maybe it could be taken care of later. We didn't know. We were, a blank slate in terms of information about, colon rectal cancer. And so we didn't know what to think.
Okay. What was your next step? Did you go see the surgeon?
The next day, I think, was a Tuesday. And we, this is out of memory here because I don't have my wife's excellent note-taking book in front of me. But I believe the next day we met with the surgeon and had a CAT scan. Or had a CAT scan first and then met with the surgeon after that to go over the results of the CAT scan. And the results of check this. I'm remembering the sequence of events a little bit better now. So we had the colonoscopy on a Friday, and we met with the surgeon the next week. And that was before any kind of scan. So he gave me a digital exam, the surgeon did. And this was after I had received notice that it was invasive cancer. So we met with the surgeon. He gave me a digital exam, could not feel the tumor, which was positive. And so at that point, because their CAT scan results were not available yet, it was possible. They didn't know what stage it was. And so it could be dealt with surgically rather than, a stage 3 cancer with chemo radiation treatment. And so for a couple of days, we didn't know which way it was going to go. And when we got the CAT scan results and then met for a second time with the surgeon is when they said it's clinically diagnosed at stage 3. That means chemo and radiation first and the whole, 9 yards that way rather than a simple, direct surgery.
And just as an aside for people listening, whenever anyone is diagnosed with a serious cancer, we go through, the medical community goes through a process of trying to stage and grade the tumor, finding out what kind of tumor it is, what kind of tissue it is, how big it is, whether it's invaded somewhere, whether it's metastasized, whether it's in lymph nodes, whether it's in other parts of the body. And all of these are the diagnostic things that go into making decisions about how to treat and how to determine the possibilities of a future with this cancer. So you were going through that. And as you're going through that, what's going on in your mind? You're getting the exam by the surgeon and you get the CAT scan. You now know it's invasive and you go back to see the surgeon. How was your experience with this surgeon?
Well, the surgeon here in Santa Barbara had a very good reputation and for his skill, and that was that was reassuring. I think we had known that ahead of time. I think the biggest shock for us was when we met with the surgeon the second time and looked with him together at the CAT scan results, and you could see the lymph nodes on the CAT scan, which you normally you're not supposed to be able to see. And so they made an estimate as to what the size of the lymph nodes were, which was under a centimeter, which is according to the medical guides, not an automatic assumption that the cancer itself has actually spread to the lymph nodes. So at that point, is really when the information overload started happening with us, because we could understand sort of conceptually a surgical approach to an issue, and then you recover from surgery and there might be whatever there is after surgery. What we certainly didn't know anything about was a different type of treatment that involved radiation and chemotherapy and two steps of surgery with a second round of chemo and all that kind of stuff. And so for about 4 to 6 weeks there was just I describe it as drinking from a fire hose in terms of information, trying to find out what all of this meant, what the guidelines were, the national guidelines for what was affecting me. And so we talked to as many people as we could. We have a couple of members of the family that we were able to tap into who were oncologists or friends of the family. And we started getting second, third, and fourth opinions at places like UCLA and different areas. And that was a struggle, because we're both trying to maintain our day jobs. At the same time, we are trying to educate ourselves as much as we can to the point where we can talk to doctors who have been through medical school and have, 10 or 20 years of medical experience. And so, the terminology and the information was overwhelming. Fortunately for us, we weren't faced, it didn't seem as if we were faced with a choice between two different paths in terms of treatment. There seemed to be a pretty strong consensus amongst all of the physicians and others that we talked to about the assumption of a stage 3 diagnosis based on some testing, as well as the treatment, the most commonly accepted and most effective treatment for a stage 3 colorectal cancer. And so we were fortunate in that we didn't have to, as lay people, make a choice between two different options that may be equally effective. It seemed like there was a pretty broad consensus about the particular way to go, which for me was 6 weeks of chemo and radiation, followed by a healing period, and then cancer, and then a second round of chemo.
Surgery. What do you mean?
Yeah,
surgery. Right. So how did you get in touch with me?
We see, my wife and I both see a local osteopath here in Santa Barbara, and we really enjoy going to see him. And he had recommended you as someone that helps patients go through this very complicated process of cancer diagnosis and treatment, and how to prepare for it and how to go through it. And so we called you up and we chatted with you and made a decision to have you help us go through the process.
It was interesting for me because on the initial conversation, both you and your wife were on the call. And in most cases, when I take on a client, I'm happy to speak with family members and friends, anyone else that might give insights into a process. But I usually work specifically with the client. But in this case, I just felt this wonderful bond between you and your wife. I listened to the two of you communicate, joke with each other, but be very serious over the phone in making even the decision to see me. And so I decided, at least for the first visit, that I would have both of you come together. And let's talk about that first visit. What was your impression with that?
So the first visit with, I call you Glenn, not Dr. Wallman, it's easier, but the first visit with Glenn was 4 hours long, and it seemed like it went by to me in about 90 minutes. It might have seemed like 6 or 8 hours to you because I think you weren't feeling well that day. But it was a real sort of question and answer period, a lot of detailed discussions about background for me, and a little bit of background for you, and discussion of the process. And I felt it was really almost invigorating process, because one of the things that I think any patient would benefit from who's been diagnosed with a serious illness is an advocate. And I think that's a service that you provide. And it's unfortunate, I think, that in today's medical system, that patients need to go outside of their insurance provider to, hire an advocate. But that's just the situation that we faced. Usually your primary doctor is that advocate, but they just commonly don't play that role anymore because they don't have the time or the resources or maybe the inclination. I'm not sure. But and so it was nice to have, after we had made the decision to hire you, we had a sense of reassurance that we were going to be accompanied in this process by an expert who is going to be an advocate for us and demystify what could be demystified and clarify things that needed clarification, and sort of pierce the veil a little bit for us. And we got a lot of that in that first meeting, and so I was happy to I was really happy with that first meeting because of how it went and the content that we covered.
Yes, I remember. I wasn't feeling well that day, but once I saw the two of you and started working, I was so invigorated by your energies together that it really actually made me feel good. So we started to work, and at that point, we seemed to have an idea of the path, as you said, but we hadn't made a decision as to which surgeon we wanted, or which chemo, or which radiation, or who was going to do this. But that's what we started working on. But I want to stop for 1 second and ask, as we get to this point, I want to ask Christina if there's anything that you're thinking about right now.
Oh, yes.
I can imagine.
Scott, I'm very curious because this is the first time that, like we've spoken to many people with imbalances, and this is the first time that I've heard of anyone finding out about their cancer online.
Yeah, it's people have your reaction. It's very common to have that reaction.
Did your oncologist, I take it, did he give you a choice to say, would you rather hear the results from me, or would you rather find out online, or was it?
It wasn't the oncologist that we didn't even know who our oncologist was going to be yet when I found out. It was the the colorectal guy who, again, sort of the system that we have here in Santa Barbara, the clinic that I have here. The physician that performed the colonoscopy, the message came from, or the diagnosis, the report back from the pathology came from him.
My goodness. So were you pre-warned that you could find out online?
Yeah, I knew that that was possible. Because again, with our system, you can get test results and things like that online.
Yes.
And so I was aware that it could be possible, and I was okay with looking at it.
Great.
Yeah, because you have the choice of, you may get a notice that there's a report there, but you could have someone else read it, or you could ask to speak with your doctor and intentionally not read it. But I was okay with just taking a look at it.
I see. So basically, it was, your test results are posted, and that's where you can view them.
Right.
I see. Got it. Okay. It's like, wow.
It wasn't like an email showed up in my inbox and said, you have cancer.
Well, thank God for that. That's wonderful. So I'm always curious as how, people find our medical guide here.
It was actually, and I think we can mention this in this particular case, only because Dr. Tim Schultz was interviewed on our show. So he is an osteopathic doctor, and he was the one that did that. So I want to keep moving forward now. When we started our process together, we knew the path, but we didn't know who was going to give the chemo, who was going to do the radiation, who was going to do the surgeries, and that was part of it. And the first part of my process is to offer people saying, where are your limits and what's your range? In other words, we could stay here in Santa Barbara for all this, or I can have you going to another hospital in California or in New York or in Europe. What were the limits? So we gathered our limits together and figured out exactly what we wanted. And then we went on a very quick path to determine who was going to be the people taking care of you. And once we had that done, we started moving quickly into the process of getting you prepared. So what would be your concept of how I helped you to prepare for this chemotherapy, radiation therapy, and upcoming surgery that we're going to talk about in a few moments?
Well, the first session that we had, you did your standard evaluation of a patient, in terms of the different areas of how you look at how someone should prepare for whatever it is that's confronting you, a disease, a treatment, a surgery. And then you do an evaluation, and it's a self-evaluation, and then you evaluate the self-evaluation. And that was instructive. I had no idea. We had no idea how you would be able to help us, other than the fact that we knew you would be able to help us, because this is what you do. And so after you went through that evaluation, the six or seven different areas of how to approach the healing process, and the preparation process, it sort of became clear to me that seemed like an effective approach to do it, and the different facets from nutrition and exercise and things like that, in addition to some of the spirituality and meditation and things like that. So from a multifaceted approach to the to again whatever that's facing you. And so that was once we went through that process, that was okay. There's a lot of work to be done, and that sort of was the jumping off point for us looking forward and into the process of the initial chemo and radiation treatment, and then ultimately surgery.
And we moved fairly quickly. From the time that we got together, within 1 month, we had chosen the chemotherapy doctor, the radiation oncologist, and the surgeons that we wanted. And that was very important for you. You wanted to feel comfortable with the people that were treating you. It wasn't just the treatments themselves. It was also about the physicians that would be part of that. And
yeah, and just to jump in on that, I think that's a really, really important part of the treatment process for any patient, regardless of what you're experiencing. But you need to be, as a patient, you need to feel comfortable with the person that's responsible for fixing you. And if you're not, I think that's going to creep into your healing process. And so if you're not comfortable with whatever surgeon, it could be the oncologist, it could be the surgeon, it could be whoever, I would encourage any patient to find someone, with whom you are comfortable, because on a certain level, I think that will facilitate your healing when you get to a comfort level. Because if you're not comfortable with someone, there's an element of stress, and stress is a killer, and you need to just reduce. You're stressed enough if you have cancer or some major disease, so you need to reduce stress wherever you can.
Yeah, that's very important. I think that's great information as a takeaway for this. So we're moving forward, and you were about to face a month or 28 days of chemotherapy and radiation therapy. And we prepared you, aside from getting a good diet and getting rid of a couple of things and improving your lab tests and starting you on some exercise programs like walking, and we started a Qigong meditation exercise. We did some visualizations and meditations, all of these things. And in fact, we developed some rituals that each time you would take your chemo or do your radiation, you went through some rituals with meditation and bringing in the process. How did that work for you?
I think it worked. I think it worked really well for me. 28 days. Obviously, never gone through anything like this before, and so when you are facing a radiation machine that's massive, and that's attacking parts of your body that are sick and parts of your body that aren't sick, anything that you can do to prepare yourself for the psychological impact of what that's happening to you. There's not a lot you can do over the physical impact of something like radiation on a near-term basis, but lots of people can get scared of going into the radiation room. That was something that I never experienced, but I saw it happen, and it can be intimidating. No one likes to be radiated. And so anything that a patient can do to prepare yourself for going to the room, going to the facility, whatever it is, waiting with other patients around you, oftentimes who are much sicker than you are, and then walking into the room and getting up on the table and having everybody else leave the room because they don't want to be radiated, and then having the machine do what it does to you. It can take a toll on you mentally, and so anything you can do to prepare for that would be beneficial. And what you suggested was to have a little ritual. And one of the rituals was to just express gratitude that you're fortunate enough to be able to be treated with this radiation, because there's millions of people in this world that don't have the opportunity to do that. You can think of 100 different examples of people all around the world that are and in this country, of course, that aren't in a situation where they have the ability to be treated with radiation for whatever it is that's afflicting them. And so that's just important to keep in mind, that as unfortunate as it is, you are being treated with, state-of-the-art medicine in a way that many people just aren't.
Mm.
And I remember one of the fears that we had is before you were getting the radiation, there were a number of measurements that were being taken, and people were giving you information that the cancer itself was this many centimeters from a certain part of your body, and another would say it's this many centimeters. So you had a fear and a concern, rightfully so, that when they were going to be irradiating you, that they got it right. We didn't certainly want you to have a cancer and irradiating the normal part of your bowel. So that was very important as part of the process. Mm. So in moving through this, you're doing really well in the chemo and the radiation. You've actually finished that now. And in the times that we saw each other, which were weekly, at the same time, we were getting lots of input from your wife, who is probably your main support system, just an amazing person. She would be sending me links to different types of cancer treatments, both pre and post-operatively, and she was always on top of this and looking for concepts and ways to improve the whole process, and that was beneficial. So we certainly want to mention the support system for anybody that goes through this. But now you're facing the next part for you is surgery. Tell us what you think the surgery is going to be about and what your fears are or were with the surgery.
Well, what the surgery that I'm facing is, you have to take the tumor out and the area around it and the lymph nodes, and surgeons typically just go in and find what's in there and deal with it, which I understand, because regardless of how good the diagnostic equipment is now, you just don't know until you're in there to see what's there or what's not, or what it looks like, or what needs to be done. So I understand that. So there's some element of uncertainty about it. But one of the terms that was used in our information gathering stage was that this is going to be a complicated surgery, and that was not a term that we were comfortable with, because you don't want to have a complicated surgery, but it's we've been told that it's going to be 5 to 6 hours. Hopefully, it's going to be laparoscopic, which means that they won't have to fillet me and gut me open, and then I'll be in the hospital for probably, 5 to 7 days. And that's a long time to be in a hospital. As we all know, hospitals are where you get sick.
And what else is going to happen in this surgery that you were concerned about, that you were not looking forward to?
Well, I'm going to have a temporary colostomy, as I think of what you're intimating at.
Absolutely.
And so nobody wants that. There's an outside chance that it might not happen, so I'm not necessarily clinging to that, but that's part of that uncertainty. But that is something that it'll be a 2-stage surgery where you have a diversion for however long the second round of chemo is, which is going to be more intense than what I'm doing now. So how much more intense? Well, it'll be IV based as opposed to the pill based chemo that I was taking before, and it'll be 2 different drugs, where I was just taking a single drug during the 6 weeks of chemo and radiation. And so I think the side effects would certainly are expected to be more pronounced in that second round of chemo. It's obviously going to be much, much longer as well.
4 to 6 months, maybe?
That's what I've been told.
Right. And again, let me reiterate, we still don't even know if those lymph nodes in your pelvis are positive yet.
That's correct, yeah. And the indication is that they are, but there's a chance that they're not. Of course, that would be fantastic.
Yep, definitely. One of the things that we started working on was a journal. Do you want to talk about that for a moment?
Sure. Yeah. One of the things that you suggested, and I think I've read, that helps patients when you're going through a long process, a year long or longer, is to keep a journal. What does that mean? A daily diary, something like that, a daily experience. Certainly, my wife was taking excellent notes of all the doctor's appointments, of which there's quite a bit of humor in this. I've had I've been examined thoroughly, and I'm ready for that not to happen anytime soon, even though I know it will. So, but there's, I think it's, again, one of the things that you suggested, which I'm continuing to carry on, is to, write down something every day that you're thankful for, and also think about something or someone that you might be empathetic about. And I think that really helped me through the chemo and radiation part, because it makes you think about your place in the world and, how fortunate you are in a lot of respects, even though you might be facing some very serious challenges. But at the same time, if you can keep a perspective about what's going on, I think it's really going to help that healing process. And I think that journal helps do that.
And I think one other thing that came from that journal was that somewhere along the way, when you started, you actually designed your own format. And if anybody is curious or wants to know that format, you can certainly get in touch with us. And I think Scott would be willing to share a simple way, because he doesn't want to sit and write all the time. But if he has a line for this and a line for that, so I would recommend that. But one of the things that came out of this is you suddenly had this desire, which we didn't talk about at the beginning, was to give back and to help other people.
Well, I like to help other people. I mean, I work for the government. Government provides services to the community, and that's one of the things that I do. And I've been a teacher in grad school. I was a TA. That was one of the things that I enjoyed most, was actually teaching in the classroom. And so it occurred to me that once I'm through this process and I have the successful outcome that I know I will, then I think it will be. I would be more than happy to make myself available to anyone that would be interested in talking to me about something that they might be facing that would be similar. Because one thing that I think would be helpful to anybody going through any sort of medical issue is to talk to people who are success stories. Mm-hmm. And so if someone says, hey, I've been through what you are going through right now, and it's tough, it's terrible, but you get through it, and I'm a better person for it. Again, I think that helps the healing process. And if I'm fortunate enough to be able to offer that, I would be more than happy to do that in the future.
And I will say that part of the reason we're doing this specifically is because of your willingness to do that honestly. And you've agreed to not only do this show, but we're going to come back a few times during your more intensive chemo and maybe after your surgeries and a few others, and follow you all the way through it. And giving back is very important, and we really honor and appreciate that from Magical Medical Tour.
Oh. Yeah, I think it's great. I think there's strength to be had on an individual basis from giving, and I think that's important for people to realize.
Wonderful. Scott, there's a few questions that have sort of crossed my desk here. And one is, as you go through this journey, as you've been through this journey, I mean, since May, how did you find your moods? I mean, did you feel any depression? I mean, we hear the word fear, which is sort of encompasses anxiety. Do you feel that you have been able to rebalance that during this time?
Excellent question. I think that again, everyone's different, and when they're faced with a diagnosis like this, what I wasn't faced with was a terminal disease. I wasn't told, you have inoperable brain cancer, for example, and you've got 6 months. And so that's a completely different animal than what I was told by all the physicians that I spoke with was what you have is highly treatable. You're going to make it through it. You're going to live a long life. Mm-hmm. And hearing that from all of the physicians was beneficial, whether it was true or not. What that helped me, which I'm sure it was true, but what that helped me, what that gave me perspective was, yeah, this is going to be a bummer, but it's not life threatening. And that's what I told people, friends and family, was this isn't life threatening. Mm. It's going to be a dark journey at times, I'm sure, but it's not life threatening. And that was the key. Mm. So I think there's sort of an either or on that. You might have something that's life threatening, and I think that's a completely different ballgame. But when you have something that very likely is not life threatening, it's going to be a struggle, but it's not going to be an end. And so that was something that really gave me perspective in terms of having, and I was aware to start with that positive attitude is extremely important. And so I'm 100% optimistic that, this time next year, I'm going to be in great shape. And I carry that with me every day. I had a friend who I celebrated my birthday sort of in the midst of all this, and right when I was starting chemo, and a friend, I was walking on the beach with him, and he said, "Are you scared?" And I said, "No." I said, "The only person I'm scared for is my wife." But she's even stronger than I am.
I'll attest to that.
Lovely. Scott, I've experienced many individuals who have dealt with some form of cancer or other, and as they go through the chemo and the radiation treatments, their body has been affected quite extreme with some, as you say, that the people, especially who are terminal in some ways. With you, throughout these 28 days, and with the support of, the work that Glenn is working with you on, how do you feel? I mean, your appetite, has it been quite balanced? Are you feeling quite strong still?
Yeah, I was really, really fortunate throughout the chemo and the radiation to not really have any significant side effects. It was 28 weekdays as I went through this, because apparently cancer takes the weekend off and holidays. Cancer gets July 4th off. So,
well, I hope you wrote that you were grateful for that one.
No radiation on the weekends. But throughout all of that, I had no impact on my appetite. My energy level maintained.
Great.
And so I was really thankful for all of that. I was able to maintain a pretty full work schedule, outside of having to actually go in for radiation treatment every day. So again, I was fortunate in that I wasn't affected by some of those common side effects.
Mm-hmm, mm-hmm. And away from your wife, who sounds like an incredible support group in herself,
Absolutely.
And are there support groups that you're also going to, or
I haven't gone to support groups. No, they're out there, and I have not felt the need necessarily to do that myself. Mm-hmm. For me personally, I don't think it would be helpful for me in my healing process to hear negative stories. And so I did go to one group that was part of a sort of a treatment process, which I think is maybe a group way to kind of go through what the types of things that Glenn suggests in his approach. And I went to the first session, and there was 3 cancer patients there, and one of them told a story about her story about being diagnosed and some of the very negative things actually that happened to her. There were some unexpected findings when they actually did surgery, and I don't find stories like that. She turned out fine and she's healthy, but I don't find stories like that to be helpful to my healing process, which are, issues with the medical treatment process or whatever it is. I just, I'm not intentionally trying to put my head in the sand, But I don't think that negative information like that is helpful to me personally through my healing process.
Wonderful. And I'm assuming you're still working.
I am.
So do you find
both before and after this show?
Before, sorry, you don't get a break.
I'm very fortunate in that I have a very supportive employer that allows flexibility, telecommuting, and things like that. So that was a key factor in my treatment process, and being able to continue working and to the extent possible. And that was again something I was thankful for.
How wonderful that you have such wonderful supporters around you, and all of us here at Yoga Hub as well.
Absolutely.
I want to let you know that.
Over the internet.
Bringing that up is very important. We did a recent interview with Dr. James Lake, an integrative psychiatrist, and he talked about distant healing and intention of healing and non-local healing. So, Scott, I haven't talked to you about this, but I know that in working in your journal, you have compassion every day for people and gratitude, and you think of people every day. And I'm suggesting now that anybody that might listen to this podcast or watch this, if you see this, take one moment and think about Scott and send him good wishes, because he's doing this for other people also, and also for many people. I have family, friends, clients, and people I don't even know that are going through this exact same thing right now. So anytime that anybody thinks about this possibility, send out good wishes to people all over the planet. I would like to see that happening. And anytime, like I said, if you watch this show and you hear it, pass it on to other people, and then think about Scott and all other people that you know at this time. Scott, we're coming close to the end of the show. We're speaking with Scott Spaulding, a gentleman who is willing to take us on his journey through his cancer therapy and treatment, and we're looking forward to the time when you can reschedule that trip to Africa. But before that, do you have a health tip for us, other than the tips you've given us already?
I have not one, but two.
Whoa. I
have, when we were talking about this show, it made me sort of think about the whole process. And I think a good, analogy or metaphor could be to think of, for anybody who's facing something, serious and that requires treatment, to think about, the medical process as a river. Water is obviously critical to life. But if you think about a river, and the river being the medical process that we have, certainly in this country, I can't speak to others, but you have a couple of choices. You're going to be in that river, and that river is going to at times control you, but it would be helpful if at times you could control the river. So one way to think about going through this whole process is as a leaf or a twig that's thrown into that river. And that river takes that twig wherever it wants to, through the shoals, through rough patches, ultimately out to the, maybe it's discarded on a beach somewhere in part of the river. But it carries that wherever it wants to go. The other way to think about it is to be yourself in that river. Either you're swimming, you're in a kayak, but you can guide yourself in different directions. And at times you may even be able to go upstream if you're strong enough. And so, I've chosen the path to try to have as much control I can over my healthcare and treatment process in this whole thing. So, different things will work for different people, but if you sort of take a broad look at what's going to be happening to you over the course of your treatment process, you can sort of, I think, go in one of those two ways. And I would certainly advocate for having more control over the direction that you're going, rather than having the river control you and sort of do what it wants to you. So that's sort of a broad way to look at it. The second thing I would say is much shorter, and that's the extreme importance of having a positive attitude towards everything when you're going through this.
Beautiful.
And so you really have to just be positive and think positively. And I would say that although I think I was generally a pretty positive person before this, I've made a very conscious effort to be far more positive, to reduce any sort of outside stress factors, because again, stress is destructive, and you just have to eliminate it to the extent that you can. So I would say just be as positive as you can, and think about everything every day, every minute of every day, how you can be positive about something that's coming in, rather than negative.
Take a breath on that and let that flow to everybody. Well said, Scott.
Copyright.
Very grateful to our very special guest, Scott Spalding, who is sharing his journey with us, and we will be on some other shows with him as we go along his journey. I'm appreciative of my teachers and my healers and allowing me on my journey. Thank you to Yoga Hub and Christina and Segovia and all of our global viewers and listeners for supporting us in this new paradigm. Look forward to getting together with all of you again at another time. And until that time, I wish you all optimal health. Thank you, Scott.
Glad to be here. Looking forward to the next show.
Yes, thank you so much, Scott. Your courage and your positive attitude is truly inspiring. I'm sure not just to those who may be dealing with some imbalance of any sort, but just to life itself. And I thank you for that. You've gifted us today greatly.
Thank you.
And of course, thank you, Doc, for again hosting another wonderful show. And we would like to thank each and every one of you for joining us in this new platform of education and information. We're grateful for your continuous support, and we look forward to hearing your feedback on how we can serve you better. You can connect with Dr. Glenn Woolman through his website, glennwoolman.com, where you can learn about his Metaphor Square Breath. And again, we encourage your questions, your comments. If you would like to leave any for Scott as well, we will make sure to get it over to him and reply to you. And we are always grateful for any other comments and suggestions. You can scroll down on the screen and type it into the comment box, or give us a call at 818-LETS-TALK, 818-LETS-TALK. Thank you for joining us today. Until next time, namaste.